Welcome back to Conversations with Consequences on EWTN Radio. I'm your host, Betsy Fentress, and I'm joined by a familiar face and voice to Catholics across the globe, Dr. Ray Guarendi. Dr. Ray is a Catholic father of 10, clinical psychologist, author, professional speaker, and national radio and television host. His radio show, The Doctor Is In, is a favorite to many, and his EWTN television series, Living Right with Dr. Ray, is in its 14th season and airs in 140 countries. Dr. Ray has given over 3,000 talks on various topics, including parenting, marriage, family, and the Catholic faith. He captivates audiences with his compelling humor-laced presentations, providing practical advice and proven techniques. Welcome to the show, Dr. Ray.
Thank you, my dear. Welcome. Thanks for having me.
Your advice as a father and as a psychologist is so needed right now. And today we want to talk about the population dearth that we're seeing and that all kinds of social psychologists and population specialists have been writing about. How is this possible that we've gone from this below replacement birth rate?
Shows you how hard it is to predict long-term trends.
Mm-hmm.
Back in the 60s, everybody was screaming, too many kids, we're going to use up all the resources, we're going to kill each other over water, and you Catholics are the worst offenders because you're having the most kids, and what's happening is you're sucking up the rainforest at an ungodly rate. All of those predictions have come to naught because now virtually every single developed country in the world is below replacement rate, some of whom will not be able to recover. There's a point where after a generation or two, if you're too low, like Japan is at 1 point, I think, or 0.9, Italy's at 0.9, South Korea is the worst. So they're just not replacing themselves. Their population is getting older. It's a demographic bomb. So that's the first thing. When God says be fruitful and multiply, he knows what he's talking about because he knows how we can get to a point as humans where we say, no, I think it's more about me. I really don't want to have kids. That's kind of demanding and it takes away from what I want to do. And nobody saw that one coming.
Well, you have people call into your show about these issues every day. You probably have a lot of grandparents. I listen to the show a lot, and I know you get a lot of grandparents calling in. Are they calling and saying, I'm waiting to be a grandparent? And, I'm going to get to the point where I can't really be of help. Do you get those calls a lot, Dr. Ray?
I get more calls of my young adult children have either severed contact with me, want no part of me, have left the faith, reject the faith, neglect the faith. I get many more calls like that. And I get some worst case scenario, which is becoming sadly more common, which is I'm not allowed to see my grandkids anymore. I'm too religious, or I have political views they don't like. So I see a lot of that.
I've heard you say that on the show.
The other thing that happens is those moms who call in, mostly moms, who have more than the allowed 1.86 children that our culture now says is okay, get grief and abuse. There's a certain irony to all this.
Mm-hmm.
We live in a culture where you can have physical relations with anyone, any way, anytime, anyhow, and we must applaud that. The one person we have no tolerance for, and we will give grief to, is a mother married to the same guy that has more than 3 children. That's when it all starts. Do you know how this is happening?
Oh, boy, I've had that.
Are these all your children? Boy, I'm sure glad it's you and not me. What are you trying to prove? When they used to ask us that, they say, these all your children? I'd say, oh, of course not. The oldest is at home with the triplets.
Well, there was an article that you were featured in the National Catholic Register called Bucking the Trend, Large Catholic Families Reflect the Beautiful Fruits of Fertility. And here's one of the quotes I love. You say, I have never once talked to an elderly parent who said, I have had too many children, but I have talked to hundreds who said, I wished I had more children.
Yes. That's very common. Unfortunately, they didn't realize at the time. And they get badgered by the culture. Oh, how you going to afford them? Okay, well, wait a minute. My 10 kids breathe the same air, and they got the same bikes handed down, and they didn't take 10 weeks of tennis lessons each one. That didn't happen. Okay, so that was it, the money. Then the other one is, well, you can't give them enough attention. I fell prey to that once. I said to my wife, I can't give each one the kind of individual attention that I would given playing with them and all of that if we only had 3. And my wife said, Raymond, that's why they have brothers and sisters.
Exactly.
I got tired of being steady pitcher in kickball. They never let me kick.
So you have 10 children, and are some of those adopted, Dr. Ray?
All 10.
All 10.
Yeah, all 10.
Tell
It's
us.
kind of like eating potato chips. You always think you can eat one more till you throw up.
Yeah, well, there's a great picture of your family, and you have a crazy Christmas sweater on, and everybody looks really happy in that article. But let's go back to the Catholic situation, because you said in this article that the Catholic Church really didn't promote big families that much. It just automatically happened. So this is all related to the widespread use of contraception now, or is it that people want a higher standard of living? They want the Disney vacation, the big car. What do you think?
I think there's a selfish component involved.
Mm-hmm.
I truly do. I talk to an awful lot of young people, and their attitude is, I don't want to be saddled. I like my life. I want to have the freedom that I have. I just saw a survey just yesterday, I think it was, that what percent was, I was like 50 some percent. It was real high of Gen Zers, kids under 27, who said they would much rather be financially well off than to be in a romantic relationship. So with that attitude has shifted. That's one. Another factor is they said that to be comfortable, you had to make $200,000 a year.
Yeah.
Well, you start throwing 3 and 4 kids in that, and that's going to take away from your 200,000 a year. I think that's another factor. A third factor is this: more people under 35 are now living together than are married. And more children with those under age 35 are born out of wedlock than in wedlock. So those are naturally constricting changes in attitudes that will stop people from welcoming children. But the contraception thing, people ask me to explain this. Why do Catholics say that in fact it's morally impermissible for someone to deliberately say, we're going to have sexual relations, but if a kid happens, I don't want it. So what I'm going to do is I'm going to stop it. And I said, well, what you're basically saying, especially if you're a Catholic who practices artificial contraception, what you're basically saying is, if God wants us to have a kid, I don't agree with him. He's wrong, and I will correct it. Okay. That's really what you're saying.
Yeah. So what do you say to the young people that call in and say, I don't want to do this? You said you talk to young people all the time. How do you, without shaming them or beating them over the head with Catholic teaching, what's the kind of sugar that you might use to lead them into a conversation where they would see things the way that you and your wife did, where your children are a gift?
I would say as long as that child remains just an idea, an abstract thing, there's not necessarily an attraction to being a parent. However, if any indication is, of all the young people I know who didn't want children but then had one, the whole world now revolves around that kid, crawls underneath their heart. So I said, you cannot imagine at this point what you would be missing because you are simply not experiencing it. You have to experience it to realize how it changes your life for the magnificent better.
Well, that's interesting that you brought that up, because another quote that I pulled from this article is your quote, "You cannot measure how much your child will climb into your heart." I loved that, because it is impossible to explain to someone the love you will feel for this creature that God has put under your care.
A lot of these young people have children that they didn't mean to have. They either got pregnant out of wedlock, something happened. All of a sudden, being a mother and father is the greatest thing in their life. And I wanted to say to them, you didn't think this before? It was something I don't want. I don't want that. And then when it happened, out of your intentions, you found out radically differently. And then they'll say, well, okay, but I think one is enough. I think one, and I'll say, well, how much do you love this one? Oh, can't even describe it. Well, what makes you think a second one wouldn't bring out that kind of love in you? Love doesn't divide, it multiplies.
So do you have in your practice couples who come in and somebody wants children and somebody doesn't? And how do you tease out that conversation where you can maybe make a little bit of headway for whoever just says, I like you said, I have this abstract view that I won't be fulfilled, or I won't have enough money, or I won't have enough time?
It depends upon their religion. So
Hmm.
if they're Catholic and this guy has agreed to raise the children Catholic and to welcome kids openly, and more often than not, it's the guy who's resistant. I would say, so when you made that promise, is it now you've decided that you don't have to fulfill it? Is it
Hmm.
you made the promise just to get married? What was it? The sad thing is, if one parent absolutely refuses, you're stuck.
Hmm.
You're stuck. What can you do? Now, fortunately, you can kind of knock down some of the objections because typically it's a series of objections, which is why I don't think we need kids. I
Right.
don't think kids are good for us.
Hmm.
We're not getting along all that well already. And you throw a kid in there, it's just going to be a fizzy into the water. So you try to get past the objections. Many of them are irrational, but hopefully they recognize that. But in the end, if one of them says, no way, no how, ain't going to happen, the other one is a victim of mistakenly choosing a partner.
Hmm. Do you look at any particular markers in our culture that you think created this pretty precipitous drop in the birth rate besides
Yes,
contraception?
yes.
What are they?
Materialism.
Hmm.
We are the wealthiest culture the world has ever seen, and we are discontent in our wealth. We have creature comforts beyond comprehension. Therefore, the more materialistic we are, the more self-absorbed we are. And that leaves less and less room for another person in our lives that we have to, at least some level, sacrifice for, whether
Hmm.
it's financially or time or emotions or the vulnerability of the whole thing. You know as well as I do that kids make you extremely vulnerable.
Hmm.
You don't know what the future holds. You don't know about illnesses. It's frightening. And so some of the people I talk to say, I don't want, I just don't want that. I don't want to have to worry about another person. I don't want to have to deal with this. And again, another factor in this is that the young people, say under 30, have the highest rates of anxiety and depression recorded. So when you are nervous about your own existence, the idea of taking care of someone else, when you're not managing your own all that well, stops a lot of them.
So, and all this goes hand in hand with, at the same time, this loneliness epidemic. And so, do people not see the connection between not being able to make a lifelong commitment in a marriage and having children and loneliness?
I have a lot of members of my family that were the older generation from me, and they stayed in marriages that now would end in divorce. There's no question. The marriages would end in divorce.
So tell us about that.
They grew up at a time when the culture didn't look at this so lazily, so laissez-faire, so celebratory.
Mm-hmm.
When the therapist didn't say, if you're unhappy, get out. I get a lot of people coming to my office, they'll say to me, I don't want a divorce, but my last two therapists pushed us that way. We don't want to go that way. We want to be respected for our moral worldview. So, in fact, what you see is right now, one, marriage is, it's an option. It's not the best one, it's an option. I saw a statistic just the other day 13% of adults age 30 are married and own their own home. 13%.
That is really low.
In 1975, it was 50. So these radical cultural shifts basically shape the way people think.
Mm-hmm.
The media, entertainment, the schools, there's just a whole new way of looking at this. And God's a little bit of he's kind of a little bit of an inhibitory mechanism here. And we got to either eliminate him or minimize him.
Mm-hmm. Mm-hmm.
So given all that, why would you? I mean, I could see someone saying, I'm not religious. I really like my life as it is. I want my freedom. I could understand them simply saying, why would I have a kid? That makes no sense. I could understand that. You have to have a certain religious worldview to say, these are precious gifts from God, and they will fill my life more than I can imagine. If you don't have that, then what's your motive, really?
So what do you think's going to turn it around? What can
Nothing.
people, nothing do?
No,
Yeah.
no, I don't. I
Hmm.
know people shock when I say that. No, I don't think it's going to turn around. I think what's going to happen is this. There may be larger subgroups of people who welcome children. You're seeing that a bit in the resurgence of Catholics, that there for a while, their families were pretty much the size of the cultures, 1.82. But now there's more and more Catholics saying we're going to be open to whatever God gives us. It's a
Hmm.
small number in the overall scheme of things,
Hmm.
but it is a growing number. So I think that's what it is. I think the culture is going to relentlessly secularize, but there will be those pockets in the subculture where people will say, this is where our contentment lies.
Hmm. And if you're promoting a big family worldview, what are the things that you say to people about the joys that you and your wife have particularly experienced? You just say, "Hey, it's really hard, but the benefits outweigh the costs," or you lay down the things that are really hard. How do you approach that?
Here is one of the things that I see as a deterrent for people going beyond two children: discipline. What has happened in our culture with the onslaught of the experts and all their new and enlightened psychological ideas is that we have stripped parents of authority. Parents are scared. They overthink, they overanalyze, they overtalk, they overnegotiate. They are nervous about doing something psychologically incorrect. So what happens is the child rearing journey becomes more of an unsettled one. It's more of a, am I doing it right? Am I doing it right? And what happens is if you don't have discipline control over the two that you have, if everything could potentially become a fight, bedtime, meal times, sibling quibbling,
Hmm.
homework hassles, chore
Hmm.
shirking, rules,
Hmm.
all of those things, especially contending with this culture, then you don't want to go beyond two. It's like, oh my gosh, these two are driving me crazy. And you see that when people find out a mother has four, five, six, seven kids.
Yeah.
Their first reaction is a gag. Oh, I can't even imagine that. How can you? I can't handle the two that I have. I don't. That's a big response. My wife said she was a better parent of 10 than she was of three
Hmm. Hmm.
because she learned. She learned which things you got to stand strong on and which things are kid junk that you can just kind of float through.
Well, and at the very basic level, you and I are going to be gone one day, but then our children will have each other. And I think it's kind of incredible that people don't see that picture of it.
A priest gave a homily in my church once, and he said he meets with a lot of very elderly folks who chose to have one child, maybe two, and they're 7 states away, 9 states away. And their elderly years, they're totally by themselves. And he said they made that decision when they were younger and didn't realize that these last 30, 40 years of their lives, pretty much the contact with their kids is going to be sporadic or hit and miss
Hmm.
or cross continent, especially if they had one. Now, again, I also hear from many good Catholic parents who say, we so much wanted more children, so
Right.
very much wanted more children. We couldn't conceive.
Hmm.
But we were done at two, we were done at three. And they say this is an interesting thing. And I think this is where those of us with a big families got to be careful. They said they get sometimes vibes from the parents of the big families that, well, you're obviously not Catholic enough. You obviously don't welcome life. And I always say, don't just assume that's what it was.
Right.
I know some very faithful Catholics who would just love to have more kids and they can't. My wife and I couldn't conceive. We were
Hmm.
done. We were told no chance, no how. I had a condition that was congenital, so I threatened to sue my mom. But the attorney told me the statute of limitations probably ran out. So I gave her a warning. This better not happen again. So we adopted, and what we found out very early was that back then, my kids are grown now. Back then, if you didn't care about the race, you could adopt tomorrow. It was much, much simpler. We have three blacks, two Hispanics, two biracial, three whites. And because we were willing to go cross race, now it's not so much that way now because
Mhm.
babies are at such a shortage. People would want to adopt any baby of any race, of any country.
Mhm.
They still have a hard time.
Mhm. Well, and then we have this whole IVF situation brewing and designer babies. And do people ever call into your show about that issue?
Not for them personally, because most of the people who listen to my show are generally pretty faith-filled people,
Right,
and
but
they
they're
kind of,
dealing with it in their families.
oh yeah,
Yeah.
oh gosh, yeah.
Mm-hmm.
And of course, the irony is you have to fertilize 8, 10, 12 little babies. And people say, it's not a little baby. And I always go, you were that age once. So those fertilized embryos are either frozen and sitting somewhere, or who knows, or you have to implant two, three, four at the same time, and one of them dies, two of them dies, three of them dies. I've even had a few kids who found out a little bit about their conception process have a little bit of pangs, which is I was the one who survived. My
Yeah.
siblings didn't.
So what do you say to those parents, grandparents probably mostly, who, I mean, once that child, is born and conceived, they're a child of God, and
Sure, of
so
course. Absolutely.
you just move on from there,
Yes,
right?
absolutely. That
Yeah.
child is a loving gift of God. And yes, you didn't you didn't do it God's way.
Mm-hmm.
Nevertheless, so like a child conceived in rape. I had a mom call my show once. Actually, not a mom, young girl, 22. She said, my mom was raped. I was the result. Everybody said to my mother, abort. You cannot carry this baby. Abort. She said, no one, not one person said to her, give the child life. And she said, I cannot tell you how much I love my mother for her courage about going against the whole world to give birth to me. It was one of the most poignant calls I ever got.
And in the Steve Jobs biography, he searches for his birth mother and he goes to the doctor and he said, I wanted to tell her to thank her for not aborting me. Look at that one person and the change in the world. I mean, we could argue right now whether we're all too addicted to, the iPhone, but I found that so fascinating that he actually searched her out to find her to tell her, thank you for letting me be born.
We let our kids know that. Two or three of our children were very close to abortion, very close.
Mm,
And we let our kids know your birth mother gave you life. She went against the wave of people telling her, take care of this.
mm.
She didn't. And so we let them know. We let them know very, very clearly. I said, now I'll kill you, but not then.
You better watch it, Dr. Ray. So, as we wrap up, give us some words of encouragement about how we talk to our young people and go forward. I know you said there's nothing we can do, like existentially, but give us some positive hope going forward here.
Somebody walks into my office and tells me what they're doing with their life, and they're making all kinds of problems for themselves. They've got all kinds of attitudes and beliefs that are just self-defeating. I can't argue with them. I got to get inside their head. I got to find out how did they get to that point where they've made these kinds of decisions, even though these decisions are proving themselves to be very flawed.
Mm-hmm.
That's what I say to parents who watch their young people, not interested in kids, not interested in religion. Say, get inside their head. Just try to understand. So So you don't want any kids. Tell me about that. What is that? What is it for you that you don't want kids? You don't argue with them, you don't debate them, you don't dispute them, you don't challenge them. That's the temptation. You just get inside their head and you make them explain out loud. Many people's attitudes are just bits and pieces of thoughts, but when they have to actually put it into a logical progression as to why they're doing this. I had a friend one time say to me, as he was virulently anti-Catholic, and I got inside his head and I was asking him some of the things he believed and why he believes them, et cetera, et cetera. And the more I asked, the more he dug his heels in, the more he just became more irate. I found out later on the way home, he said to his wife, "Did I sound as stupid as I think I sounded?" He's Catholic now, but at the time, it looked like there ain't no way I ain't dropped, my seeds are all dropping on cement. But that's not what happened. Just because I tried to understand his thinking process. That's what I say to many of the adult parents with kids who are saying, I don't want any part of all this.
Mm-hmm. Well, thank you, Dr. Ray. You've given us some great things to think about, and you're such an inspiration and a help to so many people. To learn more about Dr. Ray Guarendi, please visit drray.com, and you can always catch him on EWTN TV and radio. And to learn more about the Catholic Association and all we do, visit catholicassociation.org and catholicassociation.substack.com, and we're also on Twitter. Thanks so much for coming, Dr. Ray.
Thank you so much. God bless you and God hold you.
Welcome back to Conversations with Consequences, now on EWTN Radio. I'm your host, Mary Fiorito.
And I'm Betsy Fentress.
And so many of you have likely read a really wonderful first-person account last weekend of journalist Maddie Kearns in the pages of the Free Press about her journey to becoming a mother. And her story is colored by the amazing science of naprotechnology. So we are so grateful to have with us today Maddie's doctor, Dr. Gavin Putoff, who treated her for her infertility symptoms and has helped many other women, in addition to Maddie, to become mothers. Welcome to the show, Dr. Putoff.
Thank you so much for having me. I really appreciate the opportunity.
So you are both the founder and the medical director of Veritas Fertility and Surgery. And I know you're board certified in gynecology, and you specialize in the treatment of infertility, endometriosis, recurrent miscarriages, and other gynecological conditions. And I know you're also trained in surgical naprotechnology. So you're one of not many physicians in the country who help Catholics and then other people who don't want to enter into the world of IVF to conceive. So in 2015, I know you started the Mercy Clinic Fertility Services, and you've cared for many, many couples over the years, and you and your wife have 7 children. So
we actually just had our 8th.
Oh, did you? Congratulations.
3 weeks ago. Yes, we did. Thank you.
Boy or a girl?
This is a little boy.
Oh, what's his name?
James Frassati.
Oh, beautiful. Oh, wow.
Perfect.
Just in time for the canonization.
That's right.
That's fantastic. Well, tell us, what led you to begin Veritas Fertility and Surgery?
That's a great question. Again, thanks so much for having me on. You know, with fertility medicine and reproductive surgery, there's such a need for a concierge or really truly tailored approach to each of our patients that as many of us will try to start out a practice in a hospital system, which is where I started at Mercy Hospital here in St. Louis, we find ultimately that we want to be able to provide even another level of care compared to what we are able to do in a hospital setting. So having a private practice then gives us full control over how we build out the practice, who we hire, how we build up this team to take the best possible care of all of our patients, and allows us to be more flexible, to be able to grow with the needs of our patients. As we see the need, then we can bring on additional physicians or nurse practitioners or nurses. So having the entity where we know that we can offer this very specific, specialized, personalized type of treatment to our patients who are struggling with gynecologic symptoms, who are struggling with infertility, recurrent miscarriages, and to be able to do this in an environment and in a setting with a clinic that is so well tailored to what we do. It just means the most, both to us, but also to our patients.
So you went to the University of Dallas and then you had your medical training in Texas and in Nebraska. Can you tell us, was there a faith component for you deciding to go on this track of medicine?
Well, of course, when you think about being a practicing Catholic and going into the field of obstetrics and gynecology, going into it that you're going to run into potential ethical issues, whether it's related to in vitro fertilization or contraceptives or tubal sterilization. There's always going to be those hot topics that you're going to have to navigate during training. And of course, there's sometimes an unknown of how that's actually going to work when you're out in practice. So the fortunate thing for those of us who are coming through kind of with my generation, or even those who are coming through now, is that others have tread this path before us and have shown us that it is possible. But I think a lot of us who do this type of restorative reproductive medicine never want to be defined by what we say we won't do, but rather what we say that we can do and that other people oftentimes aren't offering, which is for me the main reason I pursued the fellowship in medical and surgical naprotechnology, because it allowed me to have this very comprehensive, in-depth toolbox, both medically and surgically, to be able to help our patients.
So, Doctor, we've had Maddie Kearns on the show in the past, as it happens, and she's an incredibly gifted writer. And though she doesn't normally write about something so personal, so it was so moving to read her story, and it really has gone viral, which surprised me a little bit because it's about a non-IVF sort of Catholic approved method of helping people to achieve pregnancy. But it would probably be helpful for our audience who might not be familiar with some of the terms we've already used, naprotechnology. And,
Sure.
Can you explain just kind of the basic definitions of what it is your clinic specializes in?
Absolutely, of course. And I think Maddie did an outstanding job. And obviously it was a beautifully written article, but also explaining that, okay, while naprotechnology was founded by Dr. Hilders in the 70s and 80s and created as this medical system, perhaps he was thinking of it primarily for Catholics to be an alternative to contraceptives, to be an alternative to IVF. It really, as Maddie said so well, is completely applicable to any and all couples who are striving to improve their overall gynecologic health or improve their fertility or be able to optimize their hormone levels. So all of that is not ideological or religious in a sense. It really is just good medicine and good surgical care for patients. I think that's an important thing for a lot of our patients to know, is that, sure, those of us who practice this way may have come into the field with sort of some religious motivations. Of course, it drives us to take on this extra training. But ultimately, when we're seeing the patient across the exam room from us or in the operating room, they're there because of the very high level of precision fertility care or gynecologic care that we provide, separate and apart from potentially any moral issues or religious issues for them as individual patients. So it's a joy, obviously, for us to be able to meet the patients where they're from and to be able to offer this alternative to the standard approaches.
So on your website, you have a section devoted to endometriosis and the ways to treat that. And you have two different procedures, one that seems to be more prevalent, fulguration.
Correct, yes.
And one that's less prevalent, which is excision. So my question is, if excision, which you can explain is a better treatment, why is the other one used way more often, and then people come to you and you have to fix what they've done in that procedure just to be able to get them up to the point where they might be able to achieve a pregnancy?
Sure. No, great question. And I have patients ask me this exact question all the time. If I can just take a moment just to describe the two types of treatments, I think it'll help to better understand why more surgeons don't do excision. So the mainstay, so-called standard of care for the treatment of endometriosis surgically, is to simply burn or ablate or cauterize the surface of the endometrial tissue implants in the pelvic tissues. I often will compare this to melting the tip of the iceberg. You quite literally have left endometriosis in the pelvic tissues as much as 60% of the time. So it's actually not a treatment. It's sort of a temporizing measure, perhaps. It might help to improve pain or even fertility for a brief time. But the rate of recurrence is so high that truly that should never be done. Ablation, fulguration, cauterization of endometriosis should never be performed because it is not the most effective way for treating endometriosis. And we know that excision is. With excision, we quite literally in the surgery are cutting the roots of the disease out. we're completely eradicating the disease from the pelvis. And I can then confidently tell our patients, by the time you roll out of the operating room at the end of the surgery, any and all spots of endometriosis have been fully removed. So the benefits are obviously are huge, because now our patients don't have residual disease that potentially can grow back. The pain relief is better. And then cutting endometriosis out results in far less inflammation or tissue damage that can then lead to scar tissue, like you mentioned. So excision always and everywhere will be the preferred and optimal treatment for endometriosis, and has the best long-term outcomes for patients in terms of fertility, but also especially for the potential need for repeat surgery or having to mess with medications or anything else down the road. The reason I think that the majority of surgeons don't perform excision is when you're going through your OBGYN residency training program, it's a 4-year program, and there's a lot to learn. You have to learn how to deliver babies. You have to learn how to take care of patients in the operating room or in the office. And so quite simply, there's just not the time to get the specialized training. Mm-hmm. And obviously, as the doctors graduate residency, if they don't pursue a surgical fellowship in endometriosis excision, like many of us do, or several of us do, I should say, then they continue to do the type of treatment that they saw performed in residency, hoping that it'll get the patients that the type of pain relief that they're looking for. And unfortunately, it just doesn't. So it really comes down to a training issue. I guess you could also say, well, there's a little bit more complexity, or a lot more complexity to an excision surgery. So it does require more precision, more training to be able to competently remove endometriosis by excision.
So unfortunately, doctor, there was a case from Alabama, where the state Supreme Court in Alabama ruled that a particular statute, wrongful death statute, could include unborn children, even if they lived in a frozen state in an IVF clinic, because the statute didn't specify that they had to be in utero in order to be considered unborn children. And that led to a terrible domino effect of laws being very hastily passed across the country to ensure that IVF will be available at all times in all places, and that IVF clinics will be completely indemnified for any malpractice that they commit. So what are the real dangers to IVF that were not really brought forward when that story broke last year? As a physician, why do you not do IVF yourself, other than the ethical and moral objections as a Catholic? What about the physical nature of doing IVF is dangerous and harmful to women? Yeah,
it's a great question. And obviously, it's a very complex scenario. But IVF, just from a philosophical standpoint, is not a cure of any disease. Mm-hmm. Women are going to address infertility, sure, but the IVF specialist simply says, we have a workaround called IVF. We're going to hijack and basically take control of your hormone system, of your ovulation for the next several months, and put you through a very strenuous set of protocols to make your ovaries and body do what they were never really designed to do, which is hyperstimulate and develop 10, 15, 20 eggs to make multiple embryos. So just the process is so physically taxing and demanding, not to mention psychologically and financially burdensome for couples and patients who go through the IVF process. And then at the end of it, potentially they would have spent tens of thousands of dollars to complete several rounds of IVF with not even a single pregnancy to show for it. So they walk away with quite literally nothing. In addition, not a pregnancy, but they haven't gotten a treatment or diagnosis or any underlying evaluation of the underlying causes of the issues that are causing their infertility. So they're left no healthier. So that, from a medical reasoning perspective, we would say, well, that's simply just not the way medicine, in my mind, should work. That we are having a patient come to us for a particular condition. We don't care enough to identify or treat the underlying reasons for that condition called infertility, which has a myriad of underlying causes. And instead, we ask the patient to just bear with us while we put their body through something that it was never meant to do. So I think that's one major issue with IVF. Of course, the other issues that attend IVF are there's a much higher rate of preterm delivery. You know, we care a lot about preterm births because it comes with higher childhood issues and infant mortality. We also know that there's a higher rate of having congenital defects like cleft lip, cleft palate, neural tube defects. Even a singleton to a singleton pregnancy, a 1-to-1, it's not just because IVF oftentimes will result in a twin pregnancy, or sometimes even a triplet or quadruplet pregnancy. But even 1-to-1, those children born of IVF are not as healthy as those born from a natural conception. The women who are going through the IVF process are at risk for having what's called ovarian hyperstimulation syndrome, which can be a very severe and even life-threatening condition in cases. So it doesn't take long to start to walk down this path of understanding. Once we know what IVF really means for the person who's going through it, yes, I know that the couples have the goal, the sight set on the pregnancy ultimately, but it not only potentially endangers the patient that is going through it because it's so intense, but also leaves you with a much lower success rate.
Can we talk a little bit about tubal ligation and the reversal of that? How often do you do that, and how successful is it in most cases?
So, tubal ligation reversal is a very successful treatment. In most cases, for our patients who are under the age of 40, we see a 70 to 75% chance for pregnancy after tubal ligation reversal when we use the microsurgical technique that we do. And generally, our patients who are coming to us, they know that their options are either, well, of course, outside of adoption potentially, but their options are basically IVF or tubal reversal. Well, here's another dichotomy where IVF is a $15 to $20 or $30,000 process with maybe a 30 to 50% chance for pregnancy, or tubal ligation reversal is under $10,000 with not just a 70 to 75% chance of that first pregnancy, but they can go on to have 2, 3, or 4 pregnancies even after a single tubal ligation reversal. So we do tubal reversals, probably several tubal reversals every single month. We love to offer these patients this very life-affirming treatment. Obviously, we're giving them their fertility back by this procedure. So it's an outstanding procedure that we get to offer our patients. And, yes, it's surgery. It's slightly invasive in the sense that we're having to make incisions, but we are restoring their normal anatomy, which is so much of what we love to do with restorative reproductive surgery, is that we just want to fix the underlying issue. We want to fix the problem. So in the tubal ligation reversal standpoint, it's a relatively straightforward, if you know the tools and you know how to do it, relatively straightforward procedure to allow somebody to regain their fertility for the rest of their gynecologic or reproductive life.
I think most people have heard the word endometriosis and have a sense of what it is. But what are some of the other conditions that might be causing infertility?
Oh, that's a big can to open up right now. So there are quite literally dozens of issues that can cause infertility. When we think about the most common, they're things like blocked fallopian tubes from some past pelvic infection or from a prior ectopic pregnancy or a surgery. We can have ovulation disorders where a woman doesn't ovulate at all, or perhaps she's ovulating in an incorrect way. The egg is not being completely released from the ovary, so it never has a chance to be fertilized. There can be issues with the uterine structure, whether it's large fibroids or polyps or scar tissue inside the uterus, that can also cause infertility. I take care of a lot of patients, for example, who have infertility, what's called secondary infertility after a C-section, simply because they have a cesarean scar niche or defect where the prior incision was made and the muscle didn't heal correctly. So that is actually probably the most common cause of secondary infertility after a C-section. And it's readily treatable with a restorative surgery. We just resect that part of the abnormal part of the uterine wall and reconstruct the uterus so that they can go on to achieve a healthy and carry a healthy full-term pregnancy. So, of course, that's just on our patient side. And then there's other nuanced issues like bacterial inflammation or chronic endometritis or issues with cervical mucus or sperm issues as well. So there's a lot there. And obviously, these are very long conversations and sometimes we get through a lot of it, different information about the patient's history. But of course, the workup also demands us to be very thorough when we start to go through and evaluate each of these different type of causes for infertility.
So is the first procedure that you would, it's not a procedure, the first thing that you would have a new patient do if they weren't already actually kind of aware of their fertility through charting or through apps? How do you feel about some of these new technologies for people to track their fertility? Do you find them successful?
I think by new technologies, you're meaning like the cycle tracking bracelets and the basal body temperature thermometers. For some patients, they can be very accurate. Unfortunately, you don't know if you're that one that it's going to work for or not. So you may be operating on less than complete information. The benefit of charting your cycle with, for example, the Creighton Model Fertility Care System, which is where NAPRA technology was really based from, is that the woman from a day-to-day standpoint gets to see the objective biomarkers of her fertility. She gets to see the cervical mucus develop around the time of ovulation, and then the mucus dries up, and you can also identify bleeding abnormalities and different problems. So you get such a more three-dimensional view of what the menstrual and the fertility cycles look like for each individual patient from one cycle to the next, which helps us to better understand and identify subtle issues like inflammation or ovulatory issues or problems with cervical mucus. So while an ovulation predictor test or a basal body temperature test in and of itself is a data point, it helps to help the woman understand her cycle a little bit better. It truly is not the most accurate way to track their system. And it also doesn't really give us that same kind of foundational understanding of what's happening with their fertility every month.
Well, Dr. Putoff, it's been such a pleasure speaking with you.
Absolutely.
Can you tell us how our listeners can get in touch with you? Do you take patients from out of state? How can any woman come and see you? Give us a little bit of information about that.
We do. So our website is veritasfertility.com. We're also on social media on Instagram, I believe, and as well as Facebook. So it's Veritas Fertility on Instagram, as well as my own account, Gavin Putoff MD, on Instagram. So that's a way that they can learn more about what we do, both on the website and also on the social media channels. The way to reach out, of course, you can always call our office and speak with Vicky up front. She takes care of all of our onboarding for our patients and gets them situated for the initial consult. We do see a lot of patients from outside of Missouri. We also see usually by a telehealth visit for the initial visit. We also see patients from across the world in different countries. So telemedicine has provided this opportunity for us to be able to see patients even if they're not in our locale. Of course, I can't do surgeries remotely, so our patients do at some point end up coming to St. Louis to be able to have the surgical correction or have a more in-depth diagnostic evaluation here at our office. But I think that allows us to be able to have a larger reach and be able to take care of more patients, which of course we love. We want to be able to help as many as we possibly can.
Well, Dr. Putoff, thank you again for joining us today. Again, to learn about Veritas Fertility, go to veritasfertility.com. And if you'd like to read Maddie Kern's moving piece, you can go to the Free Press at thefreepress.com. And to catch all of the great content by our TCA team, please visit thecatholicassociation.org. Thank you for joining us today.
Welcome back to Conversations with Consequences, and I am joined by our resident chaplain, Monsignor Roger Landry, and we're here to talk about the Queenship of Mary, the feast on August 22nd, celebrated on the octave of the Feast of the Assumption. Tell us about this feast, Monsignor.
This is a feast that the Church has celebrated throughout the centuries as a means to honor Mary, crowned with 12 stars, as the book of Revelations teaches us, as Queen of heaven and earth, a Queen of the apostles, Queen of the prophets, Queen of virgins, as we invoke her in the great litany of Loretto. The feast of her coronation is a sign that when she was assumed into heaven, she didn't just go there to veg out, to lie down on some celestial beach drinking mint juleps. She's there serving us. She's there mothering us. She's there praying for us. And so St. John Paul II, in his beautiful apostolic exhortation on Mary, the mother of the Redeemer, focused specifically that for her to reign in heaven is to serve, that she's actually been exalted to her son's right side, not to have a vacation, but to redouble her efforts in trying to serve us, to help us in every way we need to grow to full stature as God the Father's beloved sons and daughters, and also as her sons and daughters, imitating her Son all the way in loving God the Father by the power of the Holy Spirit, as he did, in loving others, as he, the enfleshment of the Good Samaritan, did, crossing the road to care for people in need, just like Jesus taught and commanded us. And so Mary, crowned as Queen of heaven and earth, hasn't given up on us, hasn't gone to a faraway place to be distant, but she's actually capable in heaven of drawing closer to all of us. And through her prayers, she's trying to serve us so that we will learn how to reign with Christ the King, her beloved Son, not through lording anything over others, but just as he who came not to be served, but to serve and to give his life as a ransom for others, so we may imitate him to the letter.
So just like we talked about last week with the Feast of the Assumption, this is a relatively new feast. And what happened in the last 200 years where we had these feasts declared, even though, as you had said last week, people have believed these since the early centuries? Was there just a need to solidify Mary's supreme place?
So we had two movements that we should know about historically. One was the Protestant Reformation, and the Protestants taught that if something were not explicitly affirmed in sacred scripture, then there's no way we could possibly believe it. Even though scripture came out of the bosom of the church, it was a result of the church's oral preaching, so many of our liturgical practices and everything else, inspired by the Holy Spirit, yes, but not exhaustive of everything God wanted us to know. But we needed to reaffirm these traditions in the church that were part of what we believe God has revealed to us over the course of the centuries about how to relate to him appropriately. And Mary is that great teacher who teaches us not only how to be good disciples and apostles and spiritual moms and dads of others, and intercessors, but also to open ourselves up to the work that she's continuing to do in our life in order to help us to precisely imitate her in those ways. And so the Protestant Reformation was the first in which we were reaffirming what we believe the Holy Spirit has guided the church to recognize over the course of the centuries. The second was rationalism, which had begun to impact both Catholic and Protestant biblical scholarship and the customs of the church. And so people were starting to say, for example, if we can't fathom something by reason alone, then maybe that isn't true. And they take rationalistic principles to try to debunk every miracle in sacred scripture, everything that had a traditional devotion to it that itself couldn't be proven by archaeology, proven by reason. And so the church, looking at these two factors, just said we need to strengthen the faith of Catholics everywhere by using the church's authority given by Christ that we clearly find in sacred scripture to say definitively that certain things that the church has always believed have in fact happened. So the church has used it, for example, for Mary's Immaculate Conception. The church, as we talked about last week, has used it to define Mary's Assumption. It hasn't explicitly used it to define Mary's coronation, which we're celebrating this Friday, but that's built on in to Mary's Assumption, that she was assumed into heaven to be the Queen Mother, because she's always been the mother of Jesus, Christ the King, etc. And so she's carrying out that queenship, as St. John Paul II intuited and helped us to grasp through her continuing the same type of maternal loving service that she exercised as she walked the same planet we still inhabit.
I wasn't really aware of this, I guess, as a young child, but it seems to be growing in popularity. And is there a reason for that? Do you think that I've just seen a lot more about the Queenship of Mary in recent years?
Well, there's been a devotion to Mary's queenship as a sign of just how august she is in our faith, that like she's not just one more saint. She's clearly not God, but she's more than just one saint. And so when we talk about her queenship, we are recognizing how her son, Christ the King, has actually exalted her. If you go to St. Mary Major Basilica, for example, in Rome, which has gotten a lot more attention this year because of Pope Francis's involvement there and his burial in April next to the great image of Our Lady Salus Populi Romani, salvation of the Roman people. There's a 13th century mosaic in the apse, which is incredibly gorgeous, in which Jesus is seated on one big heavenly throne, with Mary seated on that same bench, we could call it, and he's got an open book in which he's saying to all of us in Latin, well, saying first to her, and then broadcasting it to all of us, Veni electa mea sede art thronum meum. Come, O my chosen one, sit on my throne. And so Mary's intercession is always vicarious. It's always through her son's power. She doesn't have the power on her own. But that throne that we see at Mary Major teaches us a lot about this tradition in Catholic theology about Mary participating in Christ, her son's love for the world. And she's seated on the throne, interceding for Betsy Fentress, interceding for Monsignor Roger Landry, and interceding for the listeners who are tuned into Conversations with Consequences as we, together with Jesus, together with St. Joseph, together with all the saints, celebrate Mary's queenship.
Thank you so much. That was a wonderful explanation of a feast that we can all rejoice in.
God bless you, Betsy.
Thank you, Monsignor.